Hello, welcome to episode 4 of Let's Talk Mental Health with me, your nurse, Ajwang Leah. Well, in the previous episode, we were focusing on depression. This episode will focus on anxiety disorder. So we'll be looking at an overview of what is anxiety disorder. According to UN research, we find that 25% of Kenyans experience anxiety disorder. Now, what do we mean when we say anxiety disorder? It's a type of a mental health condition, and it is said that you have anxiety when you're experiencing some type of fear or dread. And also, you might experience physical sign of anxiety, such as pounding of the heart or sweating. Well, there's a normal type of anxiety, and it comes in a situation like when you're about to do a test, or when you are about to talk to a crowd, or maybe you're going for an interview. When we talk about anxiety disorder, it goes beyond this normal type of nervousness or fear. When you're experiencing anxiety disorder, you have no control of your emotions, and it might also interfere with your ability to perform or function. You find yourself also overreacting to something that may trigger your emotions. And that's when we say you are having an anxiety disorder. There are different types of anxiety disorder, and one of them is generalized anxiety disorder. This is when you may feel extreme or tense fear or worry of certain situations that are out of your control. We also have separation anxiety. Mostly it happens to children or teenagers when they are having the fear of separating from their loved ones. We call it separation anxiety. We have phobias. This is when you have fear of certain situations or objects, such as heights, snakes, or when you see a lot of blood, you have a fear of that kind of thing. That's when we say it's a phobia. We also have social anxiety. Social anxiety is when you get the fear of socializing with people. When there's a social situation or event, you have a fear of interacting with people because you're self-conscious. You think that they might be talking about you or saying something about you. We also have panic attacks. Panic attacks is an intense emotion that comes with heart palpitations, sweating, choking, some type of way you have those kind of attacks. That's when we say you're experiencing panic attacks. So let's look at the causes of anxiety disorder. What causes anxiety disorder? We have medical conditions. When you have been having a long-term medical condition or having heart attack or diabetes, it might cause you to have anxiety disorder. Anxiety disorder is also heredity. It goes down the family bloodline. We also have past trauma. Past trauma can cause you to have anxiety disorder. When you've been traumatized in your past life, you'll be having flashbacks or thinking about them. It might cause you to experience anxiety. What are the signs and symptoms of anxiety disorder? When you're having trouble sleeping, sometimes you are having trouble concentrating at work or at school. Heart is palpitating, or you're having sweaty hands or cold hands. Sometimes you might be having flashbacks of past trauma. Maybe you are experiencing nightmares at night. These are signs and symptoms of anxiety disorder. And when you experience these kind of symptoms, you need to seek medical help. Anxiety disorder comes with its own complication. If it's not treated on time, it might lead to physical illness or other mental illnesses, such as depression or substance use. You might find yourself trying to prevent your anxiety by using substance, and it becomes another mental illness. Social isolation, you want to isolate yourself from people because you're experiencing anxiety. It also can lead to poor quality of life or other certain diseases like heart attacks, So anxiety disorder is serious and you need to get help while still early. So how do you prevent anxiety disorder? First of all, live a healthy lifestyle. Eat well, sleep well, do exercise. Those kind of things prevent you from having an anxiety disorder. Limit your caffeine. When you are used to taking chocolate, coffee, tea, cola, limit them to a certain, because these kind of things help you, or no, this kind of thing make you experience heart palpitations, and heart palpitations might lead to anxiety disorder. So limit your caffeine. Number 3 is seek help while still early. I've just mentioned signs and symptoms of anxiety disorder. With these signs and symptoms, you might know if you're experiencing anxiety. So seek help while you feel like you're experiencing these symptoms. Look for a psychologist. Talk to a psychologist. This is a counselor who will help you overcome your fears or overcome your nervousness or you're feeling anxious. Seek help from a psychiatrist. Psychiatrists will help you get medications that will help you with your anxiety disorder. Once you are diagnosed with anxiety disorder, there are medications that you need to take, and a psychiatrist is the one who will actually prescribe this kind of medications. So seek help from a psychiatrist while you're also seeking help from a psychologist. Also, check out the medications you're buying. While you go to a pharmacy and you're buying drugs to reduce your anxiety, seek help from a pharmacist. Ask, is this drug going to help me? Don't just take any over-the-counter drugs, because they might increase your anxiety disorder. Well, there's a breathing technique that helps you while you are having an anxiety disorder. And this breathing technique is advised that you use it while you are using your medication, you are seeking help from a psychologist. Also use this breathing technique that will help you while you're having an attack, panic attack, or you're having separation anxiety, you're having social anxiety. This breathing technique helps very much. It reduces your nervousness. Again, thank you for watching. Till next time, with me, your nurse, Leah Ajwang. Bye.